Reproducibility and standardization of methodology is something that has plagued imaging response for a long time.
Tumors grow in very amorphous distributions. And that's why if we had some kind of volumetric data to look at, it would be much more precise than a single or two-dimensional measurement.
So we need something that's going to be fast, something that's going to be accurate, that kind of takes that human element out of it.
Tools that we look for are things that can help us quantify changes in tumor size, changes in the amount of necrosis, and equally important, continuing to follow the amount of necrosis to look for progression, which will tell us when an alternate therapy or a second treatment may be necessary.
Complete response or partial response. How do you make the call? And how do you answer the question, "Doc, am I getting better?" Existing methods of assessing tumor response are limited to linear measurements accepting changes in a tumor's longest axis, as measured in the axial plane, as an indication of tumor size change. Unreliable? Definitely. Of course, there are ways to calculate the volume of a tumor by painstakingly hand marking the boundaries and using complex volumetric calculations. Slow? Undeniably.
We need to be able to differentiate the tissue of the tumor from the normal organ that it resides within, and usually that's done with contrast enhancement. Where we have difficulties is being able to measure the precise size of that tumor, and that changes as we go up or down on CAT scan imaging.
The tools that do exist are cumbersome, they're not easy to standardize, and even though they are tools, they are very operator dependent. And so they lack automation. Lacking automation implies lowered or suboptimal reproducibility. And so really what we need is a tool that an operator can use, but that will be reproducible every time that operator does it over and over.
Introducing ClearStart SVM, a segmentation and volume measurement tool that puts the answers you need at your fingertips. Brought to you by Intio, a company dedicated to developing tools for interventional oncology professionals. ClearStart SVM is based on a proprietary algorithm that takes into account several parameters, enabling ClearStart SVM to instantly identify the boundaries between two tissue zones. All you need to do is find a CT or MR slice that contains the tumor, specify the limits of the normal tissue surrounding the region of interest, tag the tumor with a virtual marker, and press the button. ClearStart SVM instantly identifies the borders of the tumor in all axes, renders an accurate three-dimensional image, and yields a precise volumetric measurement. Using existing measuring technology on a simple shape, such performance would be difficult. In case of a complex shape, it would be essentially impossible.
Most tumors have tentacles, they're bilobar, they have many differing shapes, and that's where we run into problems with measurements. You may find the long axis of one tumor, which if you go up or down a slice, the long axis changes. So complex shapes make it very difficult for us to calculate longitudinal measurements.
For example, what appears to be a simple spherical neuroendocrine tumor is in reality a complex shape, the volume of which cannot be established from any linear measurement. Clinically, changes in tumor volume alone do not represent actual tumor response. ClearStart SVM can use the proprietary algorithm to give you the boundaries between enhanced tissue and tumor tissue. The calculation of the volume of enhanced tissue before treatment can be compared to the volume of enhanced tissue after treatment and subtracted from the total volume of the tumor for a more accurate assessment of treatment results. What does this amazing versatility mean to you? Measurements that until now required hours of highly trained technologists' time can now be executed at the push of a button or the click of a mouse. The benefit? The convenience of having complete volumetric data readily available on every patient, every time. Even more importantly, the results are operator independent. In other words, accurate, reliable, and reproducible over time and across institutions. This enables you to assemble a database of each patient's progress during therapy and during follow-up.
An automated system would eliminate that, and that would translate into the same result being obtained here or at a different center, because the same source data is being interpreted by the same computerized algorithms, and therefore the same result will come out.
With this ability comes the peace of mind that the therapy you have chosen is actually working. So when a patient asks, "Doc, am I getting better?" your answer can be unequivocal.